of ABG or acid base, which is the same thing, is how oxygen circulating in the body, which then affects the lung. Now, anytime you have a patient with pneumonia, COPD, or PE, they always have a respiratory therapist on board. Now, a respiratory therapist is someone who's trained, right, in the lungs department. So they know partial respiratory acidosis, they know all the nicks and knacks. Your job as a PN, licensed practical nurse or registered nurse, is to know what is respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis, and when to call the doctor and what to do for the patient. You don't need to go deep. That you just need to know the basic. Any question? We cool? So, when you go into ABGs, you must memorize these labs. pH is 735. Shh, no, please don't talk. I know you know. Don't talk. So no, shh, so people can get it. pH is 735 to 745. CO2, which when we talk about CO2, we're talking about lungs. Carbon dioxide, which is 35 to 45. When we talk about CO3 bicarbonate, which is basic, right? We talk about this has to do with kidney, GI. It is 22 to 26, or some book put 28. That should not mess you up that bad. Then we go to oxygen, which is 80 to 100, right? Oxygen 80% to 100%. Now, sometime NCLEX will put H in front, okay? Or sometimes they can put HCO2, HCO3. Don't let that fool you. Or sometimes they don't put the H, guys. They put P. Okay? But don't worry about that. You remember, those are respiratory therapist's job to figure out. I'm going to show you what's your job. Now, the first thing they ask you, whether it is compensated or uncompensated. That's the first thing they ask you. Whether it's compensated or uncompensated. Anytime they're talking about compensated and uncompensated, you only look at the pH. Row 1, question started. Hold on. From here, ma'am, from here on to her. Any question? Okay? From her down. Any question? Ms. Sonia say, anytime you're looking for compensated or uncompensated, you only look at the pH. Okay? My Kathy, from Kathy to my lady here. Any question? My lady here from here. Any question? Only compensated. My lady with the blue sweater from here to Tom. Any question? From Tom all the way down. From Monique to here. From here to here. Alguém question, true? Now, Miss Sonia, how do you figure out this compensated to come uncompensated? Class, anytime they say normal, anytime they say normal, it's either 7.35 or 7.45. When they say normal, it's only one number, 735 or 745. Any question? Now, when we say uncompensated, compensated, you have to be pH and you have to be within the range pH. Ready? Because 35 is normal. True? 36, 37, 38, 39, 40, 41, 42, 43, 44, compensated. Again, compensated. 36, 37, 38, 39, 40, 41, 42, 43, 44. Compensated. Yes.
So compensated would be from 735 to 7.
No. Remember 735 is low.
Yeah, 736 to
736 to 744. So it's within that number. Any question? Shh. Row 1. Question. Row 2. Ma bounce a sous I'ma slay it, lay it. So when I say compensated, it's 736, 37, 38, 39, 40, 41, 42, 43, 44, because I told you 735 is normal and 745 is normal. So compensated, I'm going to write it down, 736 to 744. Any question? No. All right. Uncompensated. Uncompensated. Either you are too small or too big. Uncompensated, you are 734 this way. 34, 33, 32. Bum, 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 bum. Uncompensated. Uncompensated on this side, 46, 47, 48, 49. So uncompensated, looking at the pH, you either too small or too large. Row 1, any question? Row 2, any question? Uncompensated, you look at the pH. Uncompensated, either ou 3 petit, c'est pas 35 non, on prend en 34. Either you small or you 46 high. So uncompensated is from 734 down or 746 up. Any question? They go in class. Okay, no, look at the board. What you mean you cannot see? Then you move, come see. You right up front, you cannot see. Un chaise, tu à côté pour là, come on. Yes.
What you said, uncompensated is when you start from 734.
34, 33, 34,
But it also can go from 30.
Hey!
That would be alkalosis.
No, alkalosis. We only talk about compensated and uncompensated. Don't go tell me no alkalosis. I didn't teach you that yet. We're going to learn it in pieces. Praise God. So, any question? We cool? All right. So class, anytime NCLEX asks you, is it compensated or uncompensated, what are we going to look at? pH. Any question? All right. Right? Again, anytime NCLEX asks you where it's compensated or uncompensated, what are you going to look at? pH. When they say partial, who you going to go talk to? Partial respiratory therapist. Your job as the registered nurse, you want to know if it's compensated or uncompensated. Guys, I'm an ER nurse. A lady come, her baby to deliver. I can't deliver. I could patch her up, do little things. I can't deliver, that's not my job. Partial, unpartial, that's not your doing. You didn't go to school for that. That's what respiratory therapist track is. Their focus is only on the lungs. You got it, guys? Stay focused. You got it? Any question? Now, so this is one thing. The second thing, I want to know if it's alkalosis or acidosis. Acid is acidic. Alkalosis is like savon, soap, basic. Right? Let's talk about the vagina a little bit. That's why they tell people not to douche a lot, because you don't want to lose all the acidity in your vagina, or you'll have something called bacterial vaginosis, where your vagina is dry. You need some acid. In the stomach, GERD, you don't need a whole lot of acid, but you need some acid. You got to be very careful with that, right? So some acid is good, but we don't want too much acid, right? And we don't want too much base. Any question? When we say acidosis or alkalosis, let's talk about alkalosis first, since I'm on this side of the room. Alkalosis is from, be careful, 746 on normal. 746 on back. When the patient has 735 or 745, you will hear some people say, well, 745 is alkalosis. The real term they want you to use is normal. They be 735 or 745 would be normal. It is understood that if you are a nurse, they already know this is a patient that is not having problems. When we say alkalosis or acidosis, we only looking at pH. So alkalosis, 746, 47, 48, 49, 50, big numbers, we call that alkalosis. Little numbers, because we said 735 is normal. So 734, 33, 32, 31, we call that acidosis. Any question? So far, I taught you how to read compensated and uncompensated. 1. Number 2, I taught you when something acidosis or alkalosis, there's something I said. Yes, sometimes the patient pH 745, the person say alkalosis. Yes, they said, but you as the nurse must understand, because now I'm going to ask you, the patient pH is 745. What is your nursing intervention? I'm going to kill you if you say go give oxygen, because that's understood that there's nothing wrong with the patient. Do you feel me? Do you feel me? So be careful. Learn to say 745 is normal. 735 is normal. 746 on up, alkalosis. 734 on down is acidosis. Any question? I told you I'm going to slay it. Yes, ma'am. Yes. Yes, ma'am.
735.
Whoa.
No.
734. Now on it's acidosis.
Yes, ma'am. Yes, Robin. Now you memorize it. I don't want it that way. Now you try to find something to memorize. Hey, I don't want you to memorize it. You're going to say, yes, you're right, but I don't want you to do it that way. Because you're trying to find something to hold on. No, ça c'est pas bon pour run. One team. 746 is uncompensated because that's a pH. Boom. 746 is alkalosis because anything 746 on up is alkalosis. Every time you have 746 and it's uncompensated. No. We do stuff with comprendre. You gotta make sure. Don't be trying to memorize here. All I want you to memorize, this. That's it. Everything has to do with comprendre. And she right. She young. High school. So they memorize little words. Right? Yes. No. Not compresa. Because nursing is comprehension. Yes.
So when it's 35 to 45, it's just normal?
No, not 735 to 735 or 745. It's normal. Because when you say 735 through, no. What in 735 is normal and 745 is normal. But when you say 735 through, I don't want you to use that word. You memorize it again.
Oh, what about 29?
Hold on. Say that again, darling.
What about 29?
In what? Acidosis, alkalosis, or compensated or uncompensated? We're going to help her by answering this question together. Okay. She said, oh, Miss Sonia, what is 739? So now you're going to tell me, do you want to know if it's acidosis, alkalosis, or you want to know if it's compensated or uncompensated?
I'm trying to see if it's good.
Oi, chérie, no good. You asked me a question. I want to know what is it. You said 739. 739 for what? I taught you two things. You want to be quiet. You want to know whether it's compensated or uncompensated, or you want to know whether it's acidosis or alkalosis. Thank you. Now, she asked a question. Let's help her. Class, where does 739 fall under? Between here. Right? You see, mommy? Between here. 37, 38, 39. So that tells you it is what? Bingo. Now you want to know if it's acidosis or alkalosis. 739 fall under where? Compensated. It fall under here, acid. So it is considered acidosis. Acidosis. 730, guys. All right, let me get the board. Watch. Shh. Be quiet. No, don't talk. Don't talk. I'm going to clear up the misunderstanding. Don't talk. Don't miss Sonia. Listen. Shh. I taught you two things. I want to know if it's compensated or compensated. Or incompensated. I told you, look at pH. This we got. True? Yes. All right. Now you want to know if it's acidosis, don't talk, or alkalosis. What are you going to look at?
The pH.
Stop. My ladies say 739. So I'm going to put pH 739. Now, I'm going to go to my pH. Look and tell me, where does pH fall? Don't say compensated. That's not what I asked you. Where does it fall under in these numbers? Where is a pH 739 fall under? Does it fall under here? Oh, here. Don't say compensated. All I want to know, where does the number fall in so I can write it? Show me where 7.39 tombe. Where does it fall under? Under here. True? Who did not see that? Who did not see that? Everybody see that, right? So I'm going